You think about a hospital as a safe place of healing, but what about those on the front lines who help make people feel better? You might be surprised as to how dangerous their job really is.
Patients assaulting doctors and nurses. It has been an issue for years, but it's getting worse. Good evening. I'm Eric Franke.
And I'm Sarah Carlson. You may be surprised to know that doctors and nurses are assaulted on the job more times than any other professional.
3 times more than police officers and firefighters. And Only News 3's Marc Lovicott is shining a light on this growing problem.
Each day, on average, nearly 375,000 people visit emergency departments all across the country looking for help. It can be complex care.
I've been a CNA for 5 years.
Not only for patients, but sometimes for those who perform that care.
It was a fairly routine day. I got pulled into a room to sit one-on-one with a patient.
In June, St. Mary's certified nursing assistant Rhonda Bleeker found herself in a situation she never imagined. She was monitoring a patient.
He was withdrawing from alcohol and street drugs.
Who suddenly turned on her.
He had grabbed around my wrist area and yanked me towards him and grabbed up here and just kept twisting and bending. I'm going to school for surgical tech, and I was like, oh, I hope he does not break anything, because I was like, I start school again in August. I was like, I'm not dealing with broken bones or surgery or anything. You know, that was worst case scenario, that I did not want to get anything broken.
Nothing was broken, but the patient tore ligaments in Bleeker's wrist and sprained her bicep. She instantly became a statistic. Last year, St. Mary's reported 20 workplace injuries, just like Bleeker's. That's up from 14 the year before. We checked in with others as well. UW Health reported 53 injuries last year, 56 in 2010, and Meritor 17 in 2011, 26 the year before. While numbers vary from hospital to hospital, industry publication Health Facilities Management says 23% of hospitals across the country reported an overall increase in attacks and assaults.
Whether they're behavioral health or substance abuse, we take care of everyone, and sometimes to our own peril. You're going to have folks that are upset with care, or upset that a loved one has died, or they're under the influence of some sort of substance that they can't control their own behavior.
We visited with the Emergency Nurses Association just outside Chicago, a group that has researched this trend, and a group that's #1 priority is to reverse it. In a survey last year among ER nurses, they found 1 in 10 nurses experienced physical violence over a 7-day period. Most of those cases involved patients who were drunk, and in most cases, nurses did not file a formal report.
People see it as only a problem in metropolitan urban areas. It's wherever people live.
ENA's executive director, Sue Hohenhaus, believes cases are up because more and more nurses are talking about the issue. She says change starts with support from hospital administrators, those in charge, admitting there's a problem and encouraging the reporting of incidents, and instituting a zero-tolerance policy for violence. It's exactly what's happening at St. Mary's and all of the parent company's 16 other hospitals. Not only does this problem cause physical and emotional pain for its workers, but it's costly as well. Last year, workplace violence cost the company $1.4 million in lost time.
You kind of just pick up and, okay, learning experience.
In Bleeker's case, she was completely off for 2 weeks and then on light duty for another 6. She says her employer was 100% supportive and encouraged her to report the incident. Now she just needs to work on moving on.
I try not to dwell on it and stuff, but sometimes it does come back when a combative patient comes in, and I'm kind of, okay, let's not hit me or anything else,
So the big question here, what can be done about this issue? Many hospitals, including all in Madison, have implemented policies and procedures for reporting incidents and requiring training on how to diffuse a possible dangerous situation. Advocates say that's the right way to go. In fact, they'd like to see federally mandated training for all health professionals.
Now, what about any kind of penalties for the offenders who do this?
Yeah, it's a really good point, sir. It's a felony, by the way, as most of us know, for assaulting a police officer, for example, just about everywhere. In many places, it's also a felony if you assault a cab driver, even strippers in some states. But when it comes to nurses and medical professionals, many states have no protective laws in place. It is, however, a felony in Wisconsin. Advocates say, though, elsewhere that needs to change.
No, what about police presence inside hospitals, in ERs? Does that help?
Yeah, some will say so. In fact, last year, UW Police, they started a daily nighttime presence at UW Hospital's emergency department to address some of the safety concerns they were experiencing. The Emergency Nurses Association, they say it's always good to have presence like that, but in their research, hospitals with security or police presence, they actually saw higher assault numbers. It's unclear, though, within that research if it was that presence that was a contributing factor. This is something they really want to work on.
So many healthcare workers in this area.
Yeah.
Great job on that story. Thanks, Mark.
Thanks, Mark.